tell us, or anyone that's listening that may not know about AI down to its like real under the engine, why are people excited about AI? Like, what is it about it that just is so promising that it's going to be transformative?
Well, the really interesting thing for those of us that have been in tech, and I started programming when I was 12, so I've been in tech my whole life.
I couldn't
You
read
know,
it.
well, it's actually a pretty exciting time, but AI's been around for 20 years, and people have been working on AI for a long time. I built two companies before that both used AI in machine learning. What's really come about that's different with and everybody's used ChatGPT. When ChatGPT came out and the concept of LLMs, the opportunity to attack a broader set of problems became very, very clear. And over the last couple of years, there have been more companies started than any time prior to now, especially in healthcare, because the opportunity to leverage this new technology is so exciting. What it can do for us is pretty broad. It can do everything from trying to take manual kind of administrative processes that people do today that take away from being able to care for patients directly. And we can actually give those to AI and let it go do those things. Some of them are really mundane, like as everybody knows in healthcare, we still do a lot of faxes, right? Everybody faxes stuff everywhere. Well, somebody's got to read those faxes, and AI can do a pretty good job of doing that. And obviously things like rescheduling appointments or being able to follow up, all of those kind of things that historically have taken time, AI can now do. It can even go as far as, we're working on some really cool technology to take an AI agent to actually call you on the phone and talk to you and explain things like lab results to you. 5 years ago, that seemed very far-fetched. Today, that's actually reality.
And it's so exciting, but I'm sure anyone listening is like, so what happened? Did you make a robot? Is it the fact that we finally got this whole, these LLMs, these language models? Is it because we finally got it right to where it can actually understand what our needs are and that we can communicate it accurately and then actually go do it? Or is this one the bigger one, that it actually has this insane computational power to do things in parallel, meaning where I have to do things more one-dimensionally? I have to go look at the patient, I have to look at my schedule, and then I have to then be able to think, what do they need treatment or not? When in the treatment room, how long will it take? So I have to have them in the morning if it's going to take 6 hours because our clinic closes at 5. I have to do all those things in a row. And I believe it's like the parallel functioning of in a second that it's able to do that, and also understands very well what those considerations are that I can just pin, and then all of a sudden it always knows that. So are those a couple of things? Is there something I'm missing on really why or what is so just promising and insane about what is, capable of doing?
Well, I think there's a bunch of enablers that made this happen. If you think about the sheer processing capabilities that are now available, that was a key enabler to be able to do what was done. So OpenAI introduced ChatGPT, but most people think of it as ChatGPT like 3.5 when it first came out and could do these things, but there were prior versions. The problem is the computing power was not significant enough to enable it to do things that begin to mimic human intelligence. So as you get more and more processing capabilities, and these large language models were introduced to be able to take a huge amount of data, like the entire internet, and digest that, and then be able to respond in ways that seem really intelligent. All of us go in and we play with ChatGPT, and you ask it questions, and wow, it can answer everything. It's like an online encyclopedia. That's what really enabled all of this to occur. So you can now go to ChatGPT and say, hey, I have this condition and this condition and this condition. What could it be? And it can actually go digest the world's information and come back with a reasonably well-distilled set of options. And that wasn't really feasible 10 years ago. Even 5 years ago, it was difficult. And today, it's reality. And tomorrow, it's going to get even better. So if you've seen some of the new stuff that's going on with reasoning, it's incredible. And voice is the big thing. AI agents that can talk to you and have a conversation where it becomes difficult for you to determine it's not a human. And that's where all of this is going. And I think a lot of people are worried about this is going to take jobs and things like that. In healthcare, we need more nurses, right? We don't need nurses doing paperwork. We need them seeing patients. So what AI is going to do is going to enable caregivers and providers of all types to be able to spend more time with patients and not do those things that we don't want them doing, right? We don't want them doing paperwork. You ever go into a doctor's office and the doctor's sitting behind the computer typing while you're talking to them? It's like, no, don't do that. Talk to me. And that's now possible with ambient AI. The computer and AI agents can actually take notes for you. And that's the way it should be.